everybody. Welcome back to another Lean in Olympia. I'm Meg Martin, your host and executive director for Interfaith Works. Lean in Olympia, as you all know, is our bi-monthly show that myself and my colleague Corey Passons both co-host, and we cover all kinds of topics in our community to amazing programs that are going on, social justice issues, anything at the intersection of belief, humanity, and justice here in our community of Olympia. You can watch us on Facebook, on our Facebook page, on our YouTube page, and also on Spotify in podcast form if the videos are not exactly your thing. I'm really excited because today is kicking off a series for me for my next few months of episodes that are going to focus on a couple of different aspects of what I see to be the City of Olympia's response to issues around homelessness and public safety. And I've been embedded in this work in our community for a really long time at this point. And so sometimes I feel like there's a major disconnect between what I see with folks that I'm working with in the city and what the general public is aware of or knows or really deeply understands about what's happening. And I so often hear, and I'm sure as my guest does too, like the city's doing nothing. The community's doing nothing. No one's doing anything about these issues. And I can speak for myself that that's always hard to hear because some of us are out here, 12 hours a day, sometimes more than that, like really trying to hustle to make our community a better place and to get people their needs met. And so I know that it's just an element maybe of frustration or overwhelm, but I just think it'd be cool for you all to be able to hear from a few different aspects of the city about what they really are up to and all the angles. So my first interview in this series, I'm very excited about someone that I have known for a very long time, Teal Gardener. Thank you so much for being here today. Teal currently is in a position of supervisor of one of the crisis response unit or crew teams and is here today to talk to us about the crew program.
No, thank you for having me. I'm excited to have this opportunity.
Yeah. So before we start, Teal, for those out there that might not know you, can you just tell us a little bit about yourself, how long you've been in Olympia? And what I'm most interested to hear is kind of what was like the spark that you can point to that got you into this work?
It was a bet that I lost. So I'm like third or fourth generation Olympia. My family's been here for a long time, so I'm pretty invested like that as far as like this is my place. I love it. So when I first was more downtown was when I was working up the road at a store. And I had learned about the Downtown Ambassador Program from meeting them. And I was like, that's really cool. I want to be out and about with people. And they explained what they did. And it was like outreach and advocacy for both businesses and the folks on the street. And so that really spoke to me. And then fast forward about a year or two later, I answered an ad on Craigslist and ended up down working part-time as an ambassador and part-time at a wine bar. So I used to joke, I was like, it was a terrible joke, but like at night I was like serving wine and during the day I was like, hey, how do you feel about treatment?
Yeah.
So it was a little.
Was that when the ambassadors were still at the Capital Recovery Center or were they a city program?
They were funded by the city almost totally, but it was still housed under Capital Recovery Center.
Okay.
And that's when I first really learned about peer work in general. I'm definitely a peer. I've had my own struggles in life, and so I was a runaway when I was a kid. I struggled a lot with a lot of different things, and major depression and stuff that really kind of pulls at my heartstrings while I'm out here and working out here, because it really speaks to what I don't know, what I grew up with and what I experienced in life, and just watching other people go through it. So while I was at Capital Recovery Center, I learned about being a peer counselor. Went through that course, that short course, and that really made a lot of sense. And I just, all through all of my working out, I've been out here for almost 8.5 years now, which is, I feel like, a long time.
Yeah.
But also feels like it's flown by. But I learned that everybody is a peer, one way or another, and so that was really eye-opening. So fast forwarding again, the city took over the ambassador program, and so I ended up at the city, and that was a whole new culture and language to learn, and like how to navigate certain things, because it's very different. Things move a lot slower. So then, let's see, COVID hit. We had an opening for was the homeless response coordinator, and they asked me several times, and I kept turning them down. I was like, nope, that's a really big job. I'm not qualified. And they still asked me again, and I was like, well, I'll do it. So I was interim for a year, and I would not exchange that for anything else, because I learned so much that year, saw a lot and heard a lot, that really changed a lot of my perspective on how we operate. So, and then really wanted to move more back into the real direct service work. I really missed I've always say I'm an outside cat. I like to be outside. That was one of the things when I did homeless response, is I told the city I want to do half my time outside, half my time in meetings, because if I have to go to another meeting, I can't do it.
Yeah.
So I want to be outside with the people that we serve. It's always been something that I've been passionate about, even going back as an ambassador, that a lot of folks make decisions inside of buildings and in meeting rooms, and a lot of folks that affects, they're not there to hear, say, and or be a part of it. And so one thing I really like to do is take people out on, as an ambassador, we take them out on walkabouts. So they would walk with us out around town and be like, hey, it was a lot of, we try to take city council out, and when they have an opportunity, and be like, hey, this is, some of the stuff that's happening. This is the things that we've been talking about and you've been voting on, and all of that. Here's the effect of it, good or bad. So that's something that I've carried over into this position as well. I like folks that work at the city to come out with me and see, because I hear the same thing. It's like you were saying earlier, what's the city actually doing? Are we making a dent? Do they even know we have, X, Y, or Z problem? And so it's nice to be able to bring people out and have them, what I like to say is see, smell, taste what we're all experiencing out here. So.
Yeah. Well, I want to just back up for everybody that's listening. We talk a lot about peer stuff on this show, but I'm actually I don't know if I've ever really fully defined that for listeners who might not know, but so Washington State has a certification program that is has a prerequisites, and then a 40-hour in-person training, and then a testing component to it that's both a written test and a verbal test. And it's for people that have lived experience like Teal, like myself, with substance use or addiction challenges, severe mental health challenges. That's kind of the way that the certification works, is for addiction and mental health experience. But also there are peer support programs that are for people who have experienced incarceration or homelessness. And so you essentially get this training, get this certification, and then you are qualified to work as a certified peer in organizations that provide that service. Some of those organizations are funded through Medicaid. And so those peer services can be billed to Medicaid. Other organizations like ours, I don't know, probably the city doesn't bill to Medicaid, but other organizations like ours, just from sort of more of a value standpoint, want to hire and promote peers into positions within the organization, regardless of where that funding comes from. So that's kind of what the peer work is, and it's really cool that you've brought that into so many different positions that you've worked in. And I know that I talk a lot about how how people on the street, like, their BS meter is like the best of all time. Like, they can sense if you're not being genuine, if you're not being real, if you're not being full of integrity. Like, people can sense that immediately. And so having that, like, drawing from that lived experience of where you come from is such an important way to relate to people. And I think that's what's so cool about the walkabouts also, is because a lot of times decision makers are people who maybe have not gone through similar things to what people on the streets have gone through. It's like they don't know how to talk to people. They don't know how to be around them. They don't know how to be, like, real with it. Yeah.
It is really, I mean, so we have peers at the police department as well, just other officers who have experienced it. And I mean, I feel like peer work is way more accepted now as, like, a form of, like part of people's mental health journey. But also, I remember way back when I took that course that I can't even remember who it was, that I feel bad now, but she was like, look, in the future, like, there will be jobs and all kinds of stuff related. And she was right. Cause we see it a lot of fire departments, and my brother's a firefighter, and he has peers that work there. And so we need each other. And so it's the same thing with our folks on the street. Like, it's a lot easier for me to, like you're saying, the bullshit meter goes way up if they're like, oh yeah, no, I don't need to talk to you, versus like, hey man, like, I got my own struggle. I've done this or that, or hey, I ran away when I was younger and it was, it turned out this way. It might not be that way for you, but, like, we can talk about it. People are a lot more inclined to come, be a little bit more real with you.
Yeah, for sure.
So,
Teal, will you just talk about, like, kind of give your pitch of, like, what is the crew team? And yeah, maybe let's just start there. What is the crew team? Okay.
So crew, it's Crisis Response Unit. It was modeled after the Cahoots program, which is down in Eugene, Oregon. They've been around operating for a very long time, like, I want to say 20 plus years. But we learned a lot from them. They're a little bit different. That's more of a civil, I'm a civilian, but more of like a nonprofit work, versus, like, we are embedded in the police department. And originally, so the program, first of all, it's about almost over 4 years old now. And a lot of people don't know that. A lot of folks I will hear a lot, like, we should get some, like, alternative response in Olympia. And I'm like, well, let me tell you, it's been happening for 4 years now. Yeah. And it's great though, because people are like, oh, I had no idea. But way back when it started, we were just a contract with an outside agency, but OPD still kind of under a little bit of their umbrella, because and it was challenging because there's certain things with working with the police department. We were going to be on police radio, and that's a whole thing to learn too. But there was a lot of things we had to learn and realize while we were getting into it, because you can't just, like, poof, I'm going to be part of the police department.
Right.
And so there was a lot of language to learn, a lot of radio language to learn, and trust to be built. That was at the very core of it. The relationships with officers needed to be built. The relationship with the community, like the businesses and people working and living downtown, those folks that would be calling and expecting us to be there. And then the folks that we're now serving, like the entire of Olympia, housed and unhoused. And so that those relationships take a really long time to build. And I want to say probably in the last year and a half, we've really seen that very much so like blossom and become like really a beautiful relationship with the city. We're, I think I want to say it was like 2019 city council, I think it was 2018, they voted to bring it completely in-house and not have an outside agency managing it. So that was a feat on its own because we had to bring everybody in. We have to go through some pretty significant background checks. I had a polygraph. That's super fun.
Oh wow! Yeah.
So that was a whole other experience. But so crisis response unit as a whole is almost anything related to crisis that's not crime related, which a lot of folks will be like, well, having your pants down in the middle of the street, like that's nudity in the public, like you can't, that's against the law. And it's like, yes, but on the grand scale of things, like we really, like, what's the core problem there? Is there, is that something that we can figure out? And then officers, they have a lot of work to do. That's like not that, there's stuff that's like, bigger crimes or things that actually have to be addressed versus like there's, our mental health folks that are, maybe somebody's in their own reality screaming on the corner or, or they're not dressed appropriately for the weather and they're maybe under the influence of something. We have one of the most compassionate police departments, and I have seen officers time and time again going and getting pants for people, buying them food, getting folks like, quietly ushering them to a better location that's not, in the middle of a store. And in a way that is just unlike a lot of departments. And we're kind of way ahead of our time at OPD, and that we did start crew back when we did. And now we're kind of a relief for those officers to be able to do the stuff that they need to do, and we can kind of help them out. So if it's substance related, mental health related, we've helped when folks have had, like, maybe there was a car accident and somebody needs a ride to their house or to work or somewhere, we give courtesy transports. One really big piece of all this, I should have said at the very beginning, is it's all voluntary. I tell a lot to folks is, hey, if I've never met somebody, I'm like, hey, I'm Teal, I work for crisis response, work for the police department, but, I'm here to help. You can tell me to F off right now and I'll walk away. You don't have to talk to me, but I'm here if you want it. And I would say most of the time people are like, that little bit of language the guard goes down and they're like, yeah sure, I'll give you a second. It's really nice that it's voluntary, and I wear a radio. I should have brought some myself, but I wear a radio. I have granola bars, socks, hand warmers. It's not I have no weapons on me. It's all, my biggest tool is my mouth, as I am able to articulate to people, what we're here for, if there's anything, what services I can possibly offer somebody. And it's all really tailored, dependent on that person as well in the situation. We've been called in, so after possibly, like, if there was a domestic violence situation, if the, threat has been removed, it's a very safe space. Officers are still there standing by. The person needs some resources. So that's an instance that we would possibly get called on. And it's all, I mean, stuff like that is really dependent on the officer to ask for, or the person to even want. Because, yeah, we don't want to, I mean, nobody needs to talk to us. I mean, they might have support of their own. So other times a lot of times when folks have suicidal ideation, we have a lot of folks that will call that have struggles pretty often, and we'll talk to the same person. But that's kind of nice. I mean, it's good to have someone that you can call. A lot of times folks will like, what do you think of when you're in the last resort of like, I need something, I don't know who to call, 911. Like that's like everybody knows that number, and it's so easy to be able to get a hold of. And our dispatchers, we have a really great relationship with them, and that they kind of know the criteria of like, oh, this is definitely something crew can take care of. We're 7 days a week. We've expanded recently. Originally started with like, I think we had 4 people, and now we have 9. So we go.
What are the hours? Oh yeah.
So it's 6:20 in the morning until, and then there's a shift change halfway through the day, and then that person stays until 3 a.m. Okay. So we're just shy of a 24-hour shifts available.
Okay. Wow.
Yeah.
All right. So, what would be, can you talk about like a couple of scenarios, like if somebody's having suicidal ideation, you might get called in for that. But if somebody is actively suicidal with a weapon, that would be something that the police department would go first and then potentially ask you for support for follow-up after that. Is that, so like what are some of the examples of things that would be outside of the limits of the crew team?
So, when you call 911 or non-emergency, they ask you like the series of questions. And so through that, they'll decide whether or not that person, and they'll ask those questions of like, a lot of people will call them like, I'm done. I don't want to do anything else. I'm done with life. And dispatchers will like, okay, do you have do you have a plan? Is there a, and that sounds really morbid, but it really helps us determine, like, is this something that is, they're gonna get help and get service, or they're gonna get a response from either us or officers. It's just dependent on what the level of, like, if there is a weapon involved, if there's means of them actually carrying through, and like, is there, when you're in that mindset, sometimes other people kind of fall away in your mind as far as like this other people's safety. And so we just have to be careful. We have, our team's safety is number one when we're going in. Like, we absolutely care about that person and want to help them. But we can't help them if we're not in a safe situation. So if weapons are involved, officers will respond. They might not respond too, though, if there is and I can't speak fully to this other than they just have to be really careful about what they approach. Because a lot of folks, sometimes there have been people who want that response with other intentions. And sometimes there are people that they just don't know where else to turn or what to say, and so they'll say anything to get a response. But most of the time, we'll have people that call that they've lost their job, the family's cut them off, they're just having a really low day, maybe their medication's not quite right, and so they're just in a spot where they're hopeless. And so those, if it's somebody that we've talked to times before, we've gone to times before, like, those are calls we'll either call ahead or we'll see if we can meet them in person. It's dependent on all of the factors.
Yeah. So I guess let me recap and see if it feels like I'm getting it So the crew team is part of the police department.
Mm-hmm.
The best way to access the crew team is just through calling 911.
Well, non-emergency. I mean, I say 911 because people, that's the number they're going to remember. There's like the actual like long number. So people want it. It's 360-704-2740. And I can say that again later. But it's that's the number we prefer folks to go through just because it's the same dispatch center, but they'll transfer you over to the emergency section if you accidentally call the wrong number.
Okay.
Yeah.
Okay. So crew teams, a program of the police department, goes through the same dispatch as all 911 calls do, will most likely get routed to calls that are people who are having a hard time that are not in the moment an imminent risk of harm to themselves with means to carry it through or to someone else. What about if they are like gravely disabled because of their mental health condition? Is that something you might get called to, but that you might accompany with the...
We would co-respond. So we have a designated crisis responder on the team. Different, even though we have both crisis in our name, it's different. They have the authority. I always say they're ordained to go out and remove people's rights temporarily. If they are at that point where they can't make a decision on their own, they're gravely disabled, or maybe their suicidal ideation has gone far beyond that, and now they're ready. We've co-responded to those, but it's a situational awareness thing. So our safety, being careful moving in, but also at the same time waiting for them to be like, okay, we're ready for you, or yeah, this is something you guys can be a part of. Because sometimes I was talking to somebody earlier about how they were they were attempting to detain somebody, and this person was willing to go voluntarily. But then there were more people that kind of got involved in the picture. And then at the very end, there was like 9 people there. And the person was like, whoa, wait, nope, I'm not going to go anymore. This is not. And then they took off running. And so just kind of playing your cards right and picking that right moment, because otherwise somebody's, even if they want to detain, if they run off, I'm not going to tackle them.
Yeah. So, okay, you said something that is interesting to me. So I think a lot of people might assume that everybody on the crew team is like a mental health professional. And so can you just speak to that? Like, you've got a designated crisis responder who is a mental health professional. And that's somebody who, like Teal said, has the qualifications to make the decision to detain somebody involuntarily against their will into a psych ward, basically. That's how that goes, or into the hospital. So that person, usually in our community, the group of the DCRs are contracted through Olympic Health and Recovery. So is this an Olympic Health and Recovery DCR person who works with
it's
the
a
crew
contract.
team? Okay, cool. Okay, so you've got that contract. What's like the background or makeup of the other folks that are on the crew team?
So it's a pretty cool group because we all have very different backgrounds. Like we have one person that used to work in loss prevention. We've got a person, and that everybody at the very core has an interest in helping folks and being out here. And we've got some folks that have worked in evaluation and treatment facilities. The original company, whatever, that was in charge of us, they ran ENTs and they ran all kinds of stuff. And so there were folks that came from that background. So at the core, folks have a mental health background. I don't I can't speak to every single person's like what degree they have. I will out myself and say that all I have is a GED. And I have a lot of folks that will, it's funny because there's a lot of value placed on like, higher education, which is very valuable. But there's a lot of like, I definitely went through like school of hard knocks learning. And so everyone on the team has a very different, like some people have a degree in something, some people don't have anything at all, like this guy. And so it was for me a lot of learning as I go, but I also have a longer history of like, I did search and rescue for a long time. I was a nursing assistant, which you don't need a degree for, but it's it's things that kind of accumulated to push me in this direction. Other people on the team, like they have someone in their family that struggles with mental health, or they have someone else that might, they might have had somebody in their family that struggles with homelessness. So I can't speak for every single individual on the team, but we all have a vested interest of being here. And some folks aren't even, they're from not from Olympia. But that really, to me, speaks volumes of like how much they care about this place and want to be here, because they do enjoy it and they love this community. And you can tell when we're out on calls, especially if we're in the downtown core, where we've gotten to know a lot of folks. People know everyone by name.
Yeah.
So
it's less about kind of like that somebody is like a nurse or an EMT or a social worker or whatever. It's more about, can this person basically meet people where they're at, build good rapport.
I will say maybe I'll get in trouble for this, but I've met people who have like gone through college, gotten their degrees, their masters or whatever, and then they come out and have no clue how to talk to somebody.
Yeah.
And it's really you can spot when someone's very green when they're out here, but all of our good work boils down to relationship building and our good relationships. I truly think that's what keeps us safe out here too. A lot of people are surprised. I have family that's surprised I don't carry pepper spray, or why don't you have body armor? Why don't you have pepper spray? And it's like I don't need it.
Yeah.
I have there's a lot of other smarts that are coming through, like don't put yourself in a spot where you're gonna get in harm's way. But our relationships with folks are really, really key. And so if we have somebody that comes out that doesn't even know how to talk to somebody, that's really hard. So we hire people who have a great personality, can handle. One of the things I ask in interviews, it's not an official interview question, but it's kind of like later on, is like, how are you going to feel when you've talked to somebody who's gone through a really traumatic experience? You have nowhere you can take them. Yeah. Every shelter is closed or full. And you ultimately you're going to have to walk away. And it's a really crappy thing to think about, but the resiliency you have to have in this job, and the resiliency to be out here for me, being out here 8 years, and I've gotten to know people so well now, and I've heard from folks they appreciate that we've been out here rain, shine, holiday, whatever. And so if folks can't really, if that's something they really can't do, it makes it really hard to do this job.
Yeah, that's very real. Yeah, and you start to it always gets me the most when you tell somebody that you have absolutely nothing for them, and then they're just like, well, thank you for at least saying it to me. And you're like, dang. That's a genuine gratitude that was just expressed, that you didn't waste their time, that you gave it to them straight, and that you gave it to them with respect. And we do a lot of as you know, we do a lot of like trainings in the community, and always thinking about that thing of like, yes means yes, no means no, and maybe is like the least compassionate thing that you can ever like say to somebody, because you're like giving them this sense of like, maybe there might be something, and it's like, maybe is no until it's a yes, you know? And like, I think that that's something that I feel like the general community that's not embedded in people's lives the way that we are, who are unhoused, like struggle to understand that even just like that tiny amount of respect and dignity to just look somebody in the eye and be like, I literally have nothing to offer you except that like I see you. I'm genuinely like glad to be sharing this moment with you right now. And it sucks, and I'm bearing witness to that, and like I'm here, and yeah, it does. It takes like a lot of resiliency, but not nearly as much resiliency as it takes for that person to keep facing every single day. And I just can really relate to what you're saying.
Getting in that like you were saying, like I can, you know, you're not like, I can't understand the exact situation you're in, but agreeing with that person that is a shit situation they're in, like I say that to people a lot, like this sucks, like this really sucks. And folks out here, they get you know, our folks on the street that are struggling with homelessness, they get promises made a lot, and that's something that I really try to drive home with my team, is like, we're not making promises for anything. Like I can't promise their safety. I can't promise their that they're gonna have somewhere to sleep tonight. And I have heard people, you know, who have very good intentions in their heart. They're like, oh, I'll be right back with a meal for you, or or, you know, we'll get you into housing. And I'm like,
don't say that.
Don't say that.
Yeah,
you don't need to be another person that gives them another broken promise.
Yeah.
And it's just, and so it's one of my favorite officers he writes it down on all his stuff, and it's really instilled in me, is don't overpromise and underdeliver. And that, I think in general, I try to keep that in mind with a lot of things, but with folks that we're trying to help.
Okay, but can I tell you this thing, that I have the same policy, hardcore, don't make promises that we can't deliver on. But there is a person who, you know, that, and we can talk about after this, because obviously I'm not going to say it on here, who maybe like a year and a half ago or more had been staying at the shelter years ago. We had to have them leave for a like fairly serious thing that happened. They were what we call barred from the shelter for certain things that are usually always safety related. But their bar time was up. But since then, we had moved to Unity Commons, and I ran into them in a parking lot downtown in an alley and was talking with them and was just like, okay, so here's how we're going to get you back in the shelter. Here's, you know, the pathway. I really think that you could be a candidate for the housing. And I found myself saying these things, and I was like, trust me, I'm going to get you into housing. I said that. And then I walked away, and I was like, Meg, like,
yeah.
Just moved into Unity Commons, into their own apartment. It actually happened. I looked at them last week, and I was like, I am telling you, I never make promises like that. But she was like, you told me to trust you, and I did. And I was like, I know. That was so risky. I'm sorry that I did that to you. But also, they just moved into an apartment. So I'm like, okay, phew, that time it worked. But it's like, unless you literally are someone that has an apartment to offer to somebody.
I know. Like you know for a fact ever. You have an empty room ready for them with their name on it. And, oh, well. I'm glad it worked out.
Anyway, there's the one.
Oh, man. Yeah.
But I think that's, I just think that's really important. And I think that is something that is really hard to communicate to the community at large, is just like, I don't know how to say, but I think that there's this generally this lack of acceptance for the reality of what the state of our society is. And like, I think that there's still, especially for people who have been housed and resourced for a long time,
Mm-hmm.
even if they've gone through struggles with that in the past, if they have had that resource for a very long time at this point and haven't been embedded in homeless community, I think there's this sense somehow that like we just live in a place where there should be enough for everyone. And it's like, yeah, totally. Couldn't agree more. But the reality of our society is that there is not. Or there is enough for everyone, but it's just not going to get given to the people who need it the most. And so then I feel like that's where a lot of the root of like nobody's even doing anything, or the problem's getting worse, or we're not making a dent, or we're, all this stuff. And it's like, well, yeah, because I don't know if anybody really can like grasp on a large scale in our community where we're actually at in terms of poverty and the struggles with mental health. And so I don't know, I guess, do you agree?
I have a lot of these conversations. Well, it's kind of like a lot of conversations of like, go get a job, that type of thing, or like, what is it? The get a job, get a haircut. And I'll be 100% honest. I have those days more often than, I get frustrated.
Yeah.
Because I do meet people that I know that their capability is much higher, but there's a lot of folks that are still out here that we serve that they have not, like, they've been on housing lists forever, and it baffles me.
Like working jobs, yeah.
And it's just, for me, I think it's a lack. We're all busy. Like, everybody has, families have, like, if they've got kids, they're in clubs or programs or school or whatever. And then we're just, as a society, I feel like very busy people in general. And so is there that much time to get your news other than off of TikTok? Yeah. Or, are you actually going to council meetings and learning about what is being done and voted on? Are you reading? I will admit that I hate reading emails, and I will get emails and emails of, like, lots of good information of stuff that people are doing or the city's doing, but it's hard to keep up, and there's a lot. But I do feel like if people learned more about what was happening, that's the great thing about this podcast, is that you are finding other ways to get that information out there. Because, like I was kind of saying earlier, like, things move at a snail's pace at the city. Like, any government, anything, lots of people with really good ideas are like, we should do this. And there will be either some red tape that's keeping it from happening, or it's, or there's no funding for it, or whatever. There's a billion reasons that folks come up with. But I think that in general, folks don't have a lot of understanding of what it's actually like out and about. You can get a glimpse when you're driving by, but that's when you make your assumptions. Yeah. That's when you are, I equate it, I'm just trashing on TikTok now, but, like, you go through the reels of, like, 20, 30-second video, you get that little snapshot. Same thing when you're driving around, or you're seeing something, you're like, gosh, that person has been out here forever. Like, really? Like, one more time? Like, I'm tired of seeing you, and you're making that assumption versus actually learning what's really happening and going on and where we are. That's, again, why I go back to doing the walkabouts and the ride-alongs and stuff, as it gives me a chance, even if it's like one person at a time, seems like a very small drop in the bucket, but at least if I bring one person out or even two people out at a time and show them like what's happening, talk about, what great work is being happened by organizations and by the city and, or just, what other community members have thought of, I have more time to expand on that. And then those people that I take out, they go and give out that information. Mm-hmm. Like, oh, I saw firsthand, blah, blah, blah. It's very helpful versus, just me saying it to somebody. Like we've gone to city council meetings or different meetings or businesses when they have staff meetings just to explain what we do. It's a lot more powerful when I have somebody come with me, and not everybody can do that, obviously, but it's so other opportunities to be able to explain stuff is really nice.
Yeah. There was a van. Time is so weird with the pandemic, so I can't remember when. I think it was during the pandemic, but there was this van that was downtown for a while that had a sign in the window that said, "Don't judge me based on the chapter of my life that you dropped in on." Mm-hmm. And I think about that all the time. That's kind of exactly what you're saying. Like those little snapshots are just this like tiny moment in a person's entire life. And I think about a lot of my, not all, but a lot of my messiest moments. They've all been enclosed inside a closed space, And so it's like some of my messy moments have not been in closed spaces, but, and it's like, that's a privilege that many of us, like, in our lives are not our best selves at different times. Mm-hmm. And, that gets to be behind closed doors. And for most folks out here, they don't have that ability. Yeah, okay. I think that this is all really good. I feel like, can you talk about, so you've talked about the way that Crew kind of interacts with the police department. Can you talk about how Crew interacts with like other parts of the city?
Yeah. So like city, like as city workers, I don't know what you call it, but like fire department calls us a lot. We work alongside them pretty often. They have a very small transport that they're able to do. So if somebody is like what I explained, I was like, if their leg is over there and their body's over there, that's not a crew call. Yeah. That's for fire. But if somebody's like struggling, needs a ride to like a non-emergency thing, like I've been struggling with this rash for days and days and it's not getting any better, can you take me to CMAR? That's definitely stuff we do. Or if somebody is struggling with their mental health and we can take them to the ER just to start that first process. But we work a lot with OFD, helping with transports or just being there, helping. A lot of times sometimes they'll want somebody there who knows that person that can help kind of, just make it a little bit of it easier. Like, oh yeah, you can, they're here to help or whatever it is. We ambassadors will work alongside them. Like it's kind of like if it's something just a little bit above, they'll call and ask us to come help out or be there longer. All the providers in the area, like everybody has our number to call. And, we either call and consult with folks. A lot of times I'll call in just to get some more information if somebody has like experience with somebody who, or maybe call their service provider, someone who has somebody directly that they're working with. Yes, it's great that we show up, but I can't stay there and really be there every day for somebody. So if I can get them reconnected to their navigator, reconnected to their social worker, state social worker, whoever, that's really how we kind of used to say it when I was an ambassador, and I've been saying it a lot lately, is like, I like to make your business my business. Mm-hmm. So then I know, like, I really get into people's lives sometimes. And it makes it a lot easier if you have that great relationship with people. So I was talking to folks at Providence this morning when they were getting ready to discharge somebody, and with that person's permission, we were trying to work out a plan for how that looks, which and as you know, many years past, like it's really hard when sometimes somebody's in the hospital or in a facility and they get discharged and there's like a plan, but
Right.
there's not really like a great plan and not good connections on the outside, and things just fall through. So anytime I get those moments where I can connect with somebody on the inside before someone comes out and just gets kind of, back outside, here you go. Hope here's your meds. Hope you take them. Hope they don't get stolen or lost or whatever. And that's really frustrating because we just start the cycle all over again. So I like to have a good relationship with those working in other departments or other facilities or other providers.
Yeah. Is there anything that, like, I think that, like you said, there, especially in, 2020 and the years after that, there was this really large community outcry for, law enforcement reform, about alternative responses or alternative options for law enforcement response. Olympia has always, or not always, but for a long time now, has agreed that alternative response is a good thing. And I guess I'm wondering, like, do you see that there are limitations with the crew team that we could still kind of work towards as a community in terms of alternates to law enforcement response for, like, mental health crises or substance use related crises? Like, do you know what I'm saying?
I do. I was just trying to think of like something that it's tough for us. It's okay because it's just for now until we figure out something, like it's just safety for the person and for us. But one thing that we can't do is, like, say someone does get detained by a DCR, their rights are temporarily taken so that they can go get the help they need. And if when that happens, we can't transport that person, even if they wanted us to. So we'll have to wait for an ambulance, wait for a private transport, that kind of stuff. And so that's some limitation that we have.
Is that a limitation that is like a state law limitation, or is that like a police department policy, or is that?
I believe it is a state. Someone's going to be like, that's not right. But I don't.
Well, you don't have to answer it if you don't.
I was going to say, I wouldn't be able to quote. I just know that it would be like a big no-no.
Okay. Yeah. So if you could transport people, that would be great. Or if there was some kind of faster.
Yeah.
Yeah, we just dealt with that at the shelter on Thursday. There was somebody who met criteria for detainment, but didn't want to go to the hospital voluntarily, but wasn't committing a crime in the moment. And so police wouldn't bring them to the hospital either. And so there was this, like, gap in the system, basically, which led to them not getting the care that they needed in that moment.
It is frustrating when you've known kind of the outcome, like, this person, like, they have to, basically it has to get to the point where it's so bad that they do get to, if the person's like, no, I don't need help, I don't want anything, and then it gets so bad to where we have to go out and a DCR has to see if the criteria, help me, because I was thinking, have you talked about criteria before? Because I was just thinking.
Yeah, you should say it. Yeah.
So it's threat to yourself, others, what's the third one?
Grave disability.
Thank you. I never remember that one. I don't know why.
The hardest one to have people meet criteria.
It is. Well, and it's just a lot of, like, documentation, and you have to have so much, like, they're not eating, they're not, they don't have, they're not sleeping in a safe place, or they're, practicing really unsafe behaviors and really in a either they're purposely doing it, and that would be a harm to self, or grave disability would be like they don't realize that they're being what they're doing is dangerous.
And the threshold is really, like, high or low. No, yeah, high, where you have to do so much to like meet the criteria to the point where it's typically like somebody is at risk of loss of life or limb within 24 hours. And so that's like when somebody and it makes sense because it's a really traumatic thing to get involuntarily detained. It's really hard, but I think that for those of us that are in it with people so intensely, like we never make those calls lightly. Like we never, ever like do it unless we strongly believe that somebody's life is at risk. And so then when it doesn't happen because of like a system failure, it feels really
Very
scary and hard. Yeah.
To give an example, I mean, we serve all of Olympia. It's not just downtown, not just folks out on the street. It's like we go to people's houses and their apartments and like, different living situations. And so I've gone to people's houses where, family is really struggling. One person in the family is maybe off their medication. They're really struggling, but they're not at the point where they are detainable. And so explaining that to people, what I've explained is like, what's I going to say? They know where they're at. They know where they're going to get a meal. Like, and just because they're acting out of the ordinary or they're off their meds, like that doesn't mean that we're gonna scoop them up. You're taking someone's civil liberties away. That's like you're saying, it's a huge deal. We don't take it lightly. I would be so pissed if somebody was like, well, Teal, you can't make those decisions anymore. So it's,
Yeah. And that means that like people can be forced medication, people can be forced treatment that they don't want. Like it's even less civil liberties than people receive when they're incarcerated. And so it's a really serious thing.
It's Aikido. It's not fun to be a part of and watch. Like it's traumatic. And I will say it's traumatic. It's traumatic for that person and it's traumatic for people aren't like I've watched families or friends watch this happen and like I've watched somebody go from mother, it's like, oh my gosh, help my child, like do whatever you can to like once they got to the point where they had to, put him in an ambulance and actually have to put hands on to find a safe way to get them in there, to mom being like, oh my gosh, I've changed my mind, like don't hurt my baby. And I get it. Like I'm not a parent, but if I saw that happening to like niece or nephews, I would be in the same boat.
Yeah. One thing I've always wondered about the crew team is that since it is modeled off of the Cahoots, but my understanding is that the Cahoots version is really like EMT heavy. Is that something that the crew team would ever consider expanding into, having EMTs on the team?
We've explored that a couple different times, and they're talking about maybe exploring that again. There's stuff because we have the fire department. Like there's always, making sure that we're not crossing over jobs or some of it seems frustrating when we're in the meeting talking about it, but also I can understand where they're coming from. If we have to make sure we're not. I don't know if I think it's a union, like impeding on other union stuff. So
maybe like a collaboration with OFD or something like that.
There's cool. Definitely, I don't know, there's a lot of talk about stuff like that because that would be really great. Some of the other limitations that we have is, so that medical portion of it. So, we have first aid supplies and we can give people basic first aid stuff. But I know there's stuff that can be done out in the field, field nurse work that we cannot do. It'd be nice to have, a nurse, which we had for a short time. We experimented with having a nurse that we partnered with. And who knows, that would be really cool to have that back again, because that was helpful. Again, back when I was an ambassador, we had partnered with the Department of Health, and there were some volunteer nurses that came out, and that was super awesome because it made it so that folks who they might not want to go to the doctor, can't get to the doctor, or they're in a place where they're not able to go at all. Like I had one instance where someone was not able to go because their significant other was, very much had a hold over them, and it was barring them from going lots of places, which, conversations were being had to help remedy that situation. But at the same time, there was some medical need. And so we were able to bring a nurse in, and this person was able to ask questions and really get some more information and some medication that they wouldn't have been able to receive if we hadn't done that. So I feel like we're always trying to find out of box, like, okay, we can't do this. How can we do it in a way that is safe or cheap or free? that we can make it work. So.
Well, Teal, is there anything else that we didn't cover that you wish the community could know about the work that you do?
There's a couple of things that I kind of was rolling around on. One is that kind of going back to the promises thing, and I've heard this from lots of people, is like, oh, when crew gets here, they're going to get you a ride, or when crew gets here, they're going to fix this or that. And, it's not like if somebody, if you're waiting in the fire department, they're like, don't worry, they're going to sew your leg right back on, or, just something that's very, over the top. You can't make those promises. So if folks, when they do call, you can specifically ask for crew. You can say the crisis, you can even just ask for what's the other response, or, whatever comes to your mind, because you don't always think of it. But asking for us, and it's really up to it'll be determined by, if there's certain language being used, like he has a knife, then they're not going to send us right away. But if they're if the person just asks for, they just need services or whatever, they'll usually send us. So specifically asking for us, and how's the other thing I was going to say? Gosh darn it. And being patient. So a lot of people get frustrated about response times. One thing, and I kind of will envelop this into before, we used to have 2 phone numbers that people would call, and they were not non-emergency, and they were not 911. They were just our direct phones. And a lot of people got upset when we went to calling just through dispatch. And that was really important that we made that move, because we were able to prioritize. Because you might have somebody on the west side of town that's like, I had a crappy night's sleep. I need warm clothes. I'm all wet. They might be in a safe-ish location. And, but then we have a call on the other side of town that is somebody who is just really struggling. Maybe they're having suicidal ideation, walking in and out of traffic, kind of making those maybe sort of we have to go on a priority. Yes, you're wet and cold and that's horrible, and that's, you feel bad, and we want to help you. We're going to help you, but there's something that's taking a little bit more priority. So it was important for us to go through dispatch. So if you call, we don't show up right away, you're gonna get a response from us, but it might be because we're out on another call. That's one thing that I really want to drive home. Just we'll call you back, and definitely when people do call, ask for an actual call back from us. If you want to know more, or if you have additional information, I will try my darndest to call somebody back and let them know, oh, hey, just so you know, we touched base with that person. They were okay, or maybe they were just having a hard time, or we were able to help them and connect them to whoever. So asking for us to specifically call back if you want to know what happened, within limits.
And I'm thinking so if a business owner is having a problem with maybe somebody's escalated in their business, or they're in their bathroom and they're not leaving their bathroom or something like that, that you're sort of saying tamper expectations, that we're going to necessarily be able to show up right away to handle it. If we can, we will. If we can't, that would then trigger a next response, which would be potentially considering, further involvement or trying to just handle it on your own.
Yeah, and it's interesting because I do, this was something that I learned because I used to be in the same thing. I'd be like, where the hell are the police? Why are they got here yet? Like, I don't understand. And after being on the radio and listening to what they're listening to and like seeing the volume of calls that are coming through, like they stack up. And if they are, I've seen it so many times where maybe they're on a very high priority call on one side of town and it's taken nearly everybody over there. There's usually a few people left behind, so it's not like Olympia's not like you're on your own, but they'll take everybody to like one call. And then, those calls stack up. So somebody who's maybe frustrated with like, I have someone in the bathroom we're worried about, it might wait a little while, or maybe, you're going to get a response. It's just, there's something big happening somewhere. And it's not that you've been forgotten about, because those they don't just disappear into the ether. It is there is a list, and we have to literally go through and check them off.
Okay.
With a mouse, not a pen.
Yeah. Do you know off the top of your head how many calls you got in the last year, or how do you?
Golly.
Like, even if it's ballpark.
I should have looked before I came here.
Oh, that's okay.
We do keep, so a cool thing we have is it's a collector app. It's the city made it. We used it when I was an ambassador. Parks uses it, and I think Clean Team uses it. But it geolocates to wherever we're at. We can keep track of like all the calls we've been on, what that call was, what the resolution was. If there was, there's a lot of different things you can check through, like if we transported them somewhere, if we had to call, if another service provider was involved or whatever. Part of that is like keeping track of what we do and, making sure that we're being good stewards of taxpayer money. But also it really helps, us figure out like where's kind of our hot spots, like where are we lacking in services, what can we do, like where can we go or do more in, where. So it's fun. On the way here I was talking to somebody, and I had asked them to pull up like our top people that that are frequent callers or people that we frequently have contact with, because we don't have a ton of calls at between midnight and 3 a.m., which is, our new working hours. And so finding things for our folks to do that are like, how can we respond better? Like what is lacking with like these, top people that we're going to over and over. So when I get done here, I'm going to go back and look at that. And it'll be really interesting to find out, how that will work, because we do get lots of calls. I would say on a slow day, maybe 5 calls. But I remember one time my old partner Charlie and we were competing on who could take the most calls, and at the time we were kind of poaching calls from officers that were within our means, but like we're like, oh, we'll do that, or we can do that. And I think I had 22 calls in one day, which doesn't seem like a lot, but it is quite a bit when you're spending, 10 to 20 to an hour long with somebody. And so it just...
Yeah. So it's like thousands and thousands
I was gonna say,
of calls
it's in the
year.
thousands. Yeah.
Yeah.
Including we've had thousands of contacts. Like I can't, they're doing the ComStat thing today to like give the chief all of our stats and everything. And I should have looked before I came over, because it would have been really good.
Well, no, that's okay. Is there a place on the city website or anything that people can find that info?
No, they'll put out stats, like city council will put out stats and stuff, but it's public record, so people can request to see it. There's any like personal information, so we don't get a lot of personal information, will get redacted.
Yeah.
But as far as like, if somebody wants to know, like, how is my taxes being spent? Like, is crew just going to get sandwiches at McConey's all the time, or are they like actually driving around? And so I think it's a good way for people to find out. Might take a minute or two for they get a lot of public records requests. So
yeah,
but it's worth checking out if somebody's interested.
Well, Teal, thank you so much for your time. Is there anything else? Oh, yeah.
I will say
good.
one last thing I can think of. If people are always welcome to call the non-emergency line, which I'll give again in a second. But like, even if you have a question about something, or you just kind of want to consult, like, I have somebody I've been thinking, or like there's someone on the road, I just saw him earlier, this is what was happening, like, is that, like, do you know anything about that person? I like when people call. You're not bothering us. Definitely call and just ask for a call back from crew. Mm-hmm. We're happy to find an answer if we don't have one.
So if it's more urgent, it's okay to go through 911. If it's less urgent, go through non-emergency, which is
360-704-2740.
Thank you.
Yeah.
And those are the two best ways.
Yeah, so I would say first and foremost, go through the non-emergency number I just gave. If you can't remember it, you can call the 911 number. But 911, like, if they answer and they're like, is this an emergency? And you're like, not really, then they're just going to transfer you over.
Yeah.
Because I always equate it like there's one guy sitting here and one guy sitting here. This guy's doing the 911 and this one's not. So
yeah. Cool. And then if it is something that there's like a weapon involved or a threat of harm to self or others, then community members can assume that it'll likely be the police department that arrives.
Yes.
Not the crew team, but possibly the police might be in tandem with the crew team, or the crew team might come after that.
Mm-hmm. And and there's been times where have followed up later with maybe like if it happens in a, if something happens in a public area, like we'll respond back with like later on and talk to folks, because people, one thing I like to talk about is trauma goes both ways. Like, there are folks that are experiencing trauma and it's horror and like they're really struggling, but there are people around them that are also sharing in that experience, or maybe they have a past experience themselves and it's like that kind of like comes out in that moment. And so we're there for that as well. We've responded to locations like after someone was like found deceased, and maybe like a business, somebody like a worker would go out and be like, and found the person. Like, that's really traumatizing.
Yeah.
And so, after the fact, that's something that we can go and talk to them and be like, how did that, is there something we can do? Do you want us to listen? So, yeah.
Yeah. Well, thank you, Teal.
Thank you.
I appreciate you taking the time. I know you all are really busy. I hope that everybody learned a little bit about the crew team today. Next month, I am going to have Darian Lightfoot, who I guess now I'm realizing I don't know her title either.
Oh my
But
gosh.
head of the housing and homeless response department.
I feel so bad. I should have
For City of Olympia, Darian, excited to have you on here. I hope that Darian's going to be able to talk to us a lot more about some of the affordable housing projects that are coming online, and learn a little bit more about what the city's doing to promote affordable housing in the community. So check us out on Facebook, on YouTube, on Spotify. As always, shout out Porcupine Media. And Teal, thank you so much.
Thank you.
Have a good day.